All right, I'm up at Osage Beach. I'm at Hy-Vee. I'm in the pharmacy, and this is Dr. Ellie Ellinger, and she is, well, one of the pharmacists here at Hy-Vee.
Correct.
All right, now, big smile, everything like that, and we've been talking, and you are a person who is really excited about what Hy-Vee has to offer here in the pharmacy. What excites you most about it?
Well, I originally come from a very passionate family of learning, so I love pharmacy in general, but what I'm really excited about with Hy-Vee specifically is we are the best of both worlds. We provide really intricate services to our patients, individualized. We're able to help them out with quite a few issues that some of the bigger areas can't help out with, but we also have a lot of the backing of our corporate, so we're able to get a lot of resources as well to help support our patients.
Can you give me an example of, some of the more personalized service that you're able to provide here?
Yeah, so we do a lot of work for our patients in helping them pick out like over-the-counters, recommending new Medicare plans each year with open enrollment. We can assess their needs for vaccinations. We can follow up with their doctors, make sure there's no issues with their medications, keeping them safe, as well as just there's so many different things, that each person as an individual needs, so it's hard to have a generalized statement, but...
Well, I mean, just, from my life, one thing does not necessarily work for me just because it works for that person.
Exactly, and that's where a pharmacist steps in, and especially the Hy-Vee pharmacist, we take that time to go in and say, okay, so maybe you're having a cold, let's talk a little bit more. You have blood pressure issues, we're gonna show you where the quercetin is because that's what's gonna keep you safe and prevent your blood pressure issues from getting worse. So we take that time to talk with our patients and get to know what their actual needs are.
It is important to realize that a pharmacist is not just someone who puts pills in a bottle of label and gives it to you.
No, we do so much more. Behind the scenes, every time a prescription comes into us, we're actually taking the time. We assess all the other medications you're on. We assess the conditions that we're aware of to make sure that it's safe for you to take this medication, as well as what the dosage form is. And then we're also going behind the scenes, making sure that the prices are the best. Hy-Vee has a really wonderful program that allows us to assess like coupon cards as compared to your insurance, so that we can find that we're getting you the best deal, even if it's outside of insurance.
I would say you're kind of a bulwark between, well, just because I have a prescription, it doesn't mean I have it from the doctor I normally see. There could be an emergency situation, all this, and that's kind of where you would step in.
Yes, yes. We have access to multiple portals so that we're not only keeping you safe, but also making sure it's the best effective medication for you. Because, yeah, sometimes you have those substitute doctors, and what if you were on this one eye drop and the prescription came in for a different eye drop, same disease, we're still treating the same thing, but it's not what you're used to. That's where we can step in and say, hey doc, we don't think that's what's going on, or big issue right now is there's shortages of so many medications. It's very disappointing for our patients who really need this help, but we're able to think of, hey, this antibiotic's not available, but this has that same coverage. Doc, can we go ahead and change this?
Now, is this the kind of attitude then you feel filters down to everyone who is working behind this counter?
Yes, I am so lucky here specifically at Osage Beach, and I know the other Hy-Vee pharmacists probably will have the same brag, but my staff is so dedicated. They know almost every patient by name, to the fact that they even know, oh, well, so-and-so shouldn't be on 15 milligrams of this medication. They've always taken 20 in the past before they've even looked at the chart. This staff knows their people, and they are willing to do everything in their power to make sure they're taken care of.
It sounds like it's more than just a place then to fill a prescription or maybe buy some eye drops or cough medicine.
Yes, definitely. We prioritize the outcome for people's health more so than anything else, even if that means, this isn't the best option for you to be on the medication. We would rather you be the safest and most effective treatment, regardless of where we're at. We just want to make sure we're taking care of our people.
And that comes obviously from personalized service.
Yes. And our patients make it easy too. We have some of the best patients coming here too, so we have a lot of fun.
Okay, so now we're going to be coming back here to the pharmacy at Osage Beach, and we're going to talk maybe a little more specific about some of the things that they have to offer. Back to you.